You ready to study, Santina?
I guess so.
What should we start with? I think we should just start with patho.
Oh yeah, definitely.
Okay, let's start with shock.
Shock?
Yeah, I'll pull up my notes.
Alpha receptors are broken down into alpha 1 and alpha 2. Alpha 1 has effects such as vasoconstriction, glycogenolysis, and mydriasis. Alpha 2's effects block sympathetic activity. Beta is further broken down into beta 1 and beta 2. Beta 1 increases contractility, increases heart rate, and increases renin. Beta 2 has dilation of the bronchioles and acts on the lungs.
Understanding the pathophysiology of shock. Shock begins with inadequate perfusion, which initiates a cascade that can potentiate into death and leads to impaired cellular metabolism, which consists of impaired oxygen and glucose use. We'll get to this later. Shock progresses to the inflammatory and stress response, which initially will counteract each other and maintain a normal blood pressure. The stress response causes the release of catecholamines and results in vasoconstriction, while the inflammatory response causes vasodilation, which will take over the stress response and result in systemic vasodilation. Shock can eventually lead to multi-organ dysfunction, which is 2 or more organ systems failing, positive feedback loops, and death. Impaired cellular metabolism will result in impaired oxygen use. With decreased oxygen carrying capacity and utilization, anaerobic metabolism will occur. A byproduct of anaerobic metabolism is lactic acid, which causes a decrease in pH. Anaerobic metabolism will deplete ATP, which causes the sodium-potassium pump to become dysfunctional. Sodium will accumulate inside the cell, while potassium will accumulate outside of the cell, the opposite of what normally occurs. This shift in electrolytes affects both the brain and the heart. As we know, water follows sodium like a magnet. Water will accumulate inside of the cells, which results in cellular edema. This fluid shift depletes the circulatory volume in the vascular system, where it is no longer available for use. Cellular edema will cause the cellular membranes to become disrupted. Disrupted membranes allows the release of destructive lysosomal enzymes, which normally break down cellular debris, in the bloodstream, which causes the destruction of tissues. This cascade of events activates 3 positive feedback loops: a decreased circulatory volume, lysosomal enzyme destruction, and activation of the clotting cascade as a result of the inflammatory response, which can proceed into DIC, a common complication of shock. Impaired cellular metabolism will also result in impaired glucose delivery and use. Impaired delivery occurs as a result of inadequate perfusion. Impaired uptake occurs as a result of the stress response. With increased cortisol, thyroid hormone, and catecholamine release, tachycardia, hyperglycemia as a result of glucose mobilization, and insulin resistance will occur. This causes the cells to shift to gluconeogenesis. The cells are trying to find new sources of glucose, and glycogen stores are depleted in 10 hours. This results in the use of fat and protein. Gluconeogenesis has a high metabolic cost. In other words, this uses a lot of ATP, which is another part of the feedback cycle. Gluconeogenesis will lead to a depletion of protein. Plasma proteins, albumin, are targeted first. This causes a decreased osmotic pressure and fluid leaks into the interstitial space, which potentiates the positive feedback loop discussed previously, a decreased circulatory volume. Septic autocannibalism will occur, or a breakdown of skeletal muscle, including the diaphragm, which can cause respiratory failure. A byproduct of protein breakdown is ammonia, which is converted to urea by the liver. A toxic buildup of this metabolic end product causes a spiraling effect, further disruption of cellular function and membrane integrity. Shock can be irreversible.
Time for a study break.
Oh,
You guys ready?
Yeah.
Let's see what's on TV.
Okay.
Hello, friends. I'm your debutamine girl. Do you suffer from dyspnea, oliguria, hypotension? Are you unpopular? Do you have dusky skin? Confused? Have you had an alias? Do you poop out at parties? Recent MI, CHF, or dysrhythmias? If so, you might be suffering from a decreased cardiac output as a result of cardiogenic shock. The answer to all your problems is in this little baggie. Dobutamine contains beta-1 selective properties, an increased force, increased conduction, and a decrease in systemic vascular resistance. Yes, with dobutamine, you can infuse your way to health. It's so easy, too. Just go to your nearest ER and ask for dobutamine. Just like candy. If you're experiencing hypertension, hypotension, tachyarrhythmias, chest pain, or hypokalemia, contact your physician because you may be experiencing side effects. And remember, that's dobutamine.
Do you have a hypersensitivity reaction to peanut dust, penicillin, bee stings, guinea pig dander? You are not alone. Hi, I'm Heather Brush, CEO of EpiPen. Living with an allergy can cause all sorts of problems, such as vasodilation and bronchospasm, histamine release that causes intense itching and hives, and increased vascular permeability, elevated heart rate, and in addition, it can increase your cardiac output. These symptoms are sudden onset and need to be treated rapidly. In the event you are in the hospital, you will be receiving epinephrine, diphenhydramine, and famotidine to treat this condition. But for home use, you'll need our handy, reasonably priced EpiPen.
Epinephrine is essential in anaphylactic shock because it stimulates all of the adrenergic receptors in the sympathetic nervous system. Alpha-1 causes vasoconstriction and helps to perfuse the tissues. Beta-1 stimulates the heart, causing inotropic and chronotropic effects of the heart. Lastly, it acts as a bronchodilator by stimulating beta-2 receptors in the lungs. Side effects include nervousness, restlessness, tremors, headache, insomnia, angina, arrhythmias, hypertension, tachycardia, nausea and vomiting, and hyperglycemia. Use caution if you experience cardiac disease, hypertension, hyperthyroidism, diabetes, cerebral arterial sclerosis, and glaucoma.
Life isn't fair, and it sure as hell ain't free. For a reasonable price of only $608, you too can breathe again after anaphylactic shock. I hope for your sake you're made of money, because follow-up medical attention is required. Call your doctor today and buy 1 or 3 EpiPens. You never know when you're going to come in contact with a guinea pig.
Are you suffering from neurogenic shock as a result from a spinal cord injury, like me? Your volume might be stable, but a dominant parasympathetic state will cause the loss of vascular tone. You may be experiencing hypotension, bradycardia, and a decreased systemic vascular resistance. If this sounds like you, call 911 immediately. Or, if you're paralyzed, have someone call for you and ask about dopamine. You ski bums might relate dopamine to the pleasure and reward center, but it's also a potent vasopressor that can treat shock by activating your alpha-1 and beta-1 receptors.
Ask your doctor about doses because dopamine has dose-dependent activation. A low dose activates dopaminergic receptors, causing dilation of the renal, mesenteric, coronary, and cerebral arteries. A moderate dose produces inotropic and chromotropic effects by activating beta-1. A high dose produces vasoconstriction by activating alpha-1. Dopamine has an onset of 2 to 5 minutes and an elimination half-life of less than 2 minutes. Side effects include arrhythmias, tachycardia, hypotension, hypertension, anxiety, ectopic beats, tachycardia, angina, palpitations, nausea and vomiting, dyspnea, necrosis, anaphylactic shock, and extravasation at the IV site.
Do you find yourself with increased heart rate? Are you febrile with increased permeability and lactic acid related to anaerobic metabolism? Do you have profound vasodilation? I do. If so, you might have sepsis that could lead to septic shock and multiple organ dysfunction syndrome and death. Sepsis can be caused by any infection that enters the bloodstream, like pneumonia, infected wounds, and central lines and drains. If you suspect sepsis, go to the hospital, you idiot. Make sure to tell your doctor that in addition to heavy antibiotic therapy, you need Levofed.
Levofed is a sympathomimetic amine drug that has an affinity for both alpha-1 and beta-1 adrenergic receptors. Alpha-1 stimulation allows for vasoconstriction to promote perfusion, and beta-1 stimulation promotes positive inotropic effects, allowing your heart to pump harder and faster. Onset of Levofed is immediate, and the elimination half-life is less than 5 minutes, so avoid stopping the infusion to prevent rebound effects. Side effects include anxiety, dizziness, headache, insomnia, restlessness, tremor, weakness, dyspnea, arrhythmias, bradycardia, chest pain, hypertension, decreased urine output, renal failure, hyperglycemia, metabolic acidosis, phlebitis at the IV site, and fever.
Make sure to educate your doctor about the need for phentolamine in the event of infiltration of levophet into the tissue surrounding your IV site, causing subsequent necrosis and tissue death. If you have shock, talk to your doctor today, like right now, like call 911 because you're like dying and you need to prevent like multiple organ dysfunction syndrome and death related to your diagnosis of septic shock. Advocate for yourself. Ask for levophed.
Are you currently bleeding out? If so, you might be in hypovolemic shock. How to know for sure? Ask yourself these questions. Is your pulse fast and thready? Are you barely peeing? First things first, have your doctor put on IV fluids, but then try phenylephrine, a potent alpha-1 vasoconstrictor. Talk to your doctor today if you want the best. Phenylephrine.
While taking phenylephrine, you might also experience vasoconstriction of your nasal passages and mydriasis, or dilation of your pupils. There's no need for concern, these effects are normal. Phenylephrine works by causing vasoconstriction that increases mean arterial pressure. In patients with low arterial pressure, despite adequate fluid resuscitation, phenylephrine can help. It increases both blood pressure and stroke volume. Unlike other drugs available for shock, phenylephrine has less beta-adrenergic effects and therefore may have less cardiac side effects.
So why were there so many drug commercials?
Yeah,
That was weird.
know, but I definitely think I have cardiogenic shock.
I think you do.